Actor Chadwick Boseman died of colon cancer last night at the age of 43.
He's best known for Black Panther, but he also portrayed legends Jackie Robinson, James Brown, and Thurgood Marshall. Boseman died after a 4-year struggle with colon cancer. He kept working while undergoing surgeries and chemotherapy. His wife and other relatives were by his side when he died. A statement from Black Panther production company Marvel Studios says, "Our hearts are broken and our thoughts are with Chadwick Boseman's family. Your legacy will live on forever. Rest in peace." A devastating loss like this brings attention to colorectal cancer, especially since we've heard that type of cancer is often curable.
Joining us now is Dr. Dana Hayden from Rush University Medical Center, a colorectal surgeon. Doctor, thank you for joining us. Now, it was the assumption probably of many people that this is a cancer for advanced age, but that is not the case. He was only 43, correct?
That's correct. So age looks like it's really no longer a factor when it comes to this cancer. So we have to be really vigilant when it comes to screening people at appropriate ages, but also being aware of symptoms that might occur much earlier, even if there's no family history for that patient.
So what is the screening recommendation? How old, how often?
So currently there's a handful of societies that have lowered the age for African Americans to 45. For those that are of average risk, meaning no family history and no symptoms, the age still remains 50. However, there is now discussion because colorectal cancer is increasing in those under 50. The incidence has been increasing over the last several years to start thinking about lowering the age. It is important to remember that this is just for screening, which is very different than if someone's having symptoms like blood in the stools or changes in bowel habits. That can happen at any age, and that's something that the patient really needs to go talk to their physician and be an advocate for looking into this.
Doctor, is there any reason behind this showing up in younger people more and more?
So there's research that's looking into it, and we're not exactly sure. Some have thought that maybe it's changes in less physical activity or those having a more sedentary lifestyle compared to 10 or 20 years ago, changes in diet, but we're still not really sure. So there's plenty of researchers, including us at Rush, that are looking into to see if there's something about tumor biology that is affecting younger patients that are getting colorectal cancer much earlier than we expect. So that's why, for me, if anyone mentions the word bleeding to me in the office or any sort of symptoms, I immediately talk to them about pursuing workup for that, which is usually a colonoscopy.
So important to get checked. Dr. Dana Hayden, thanks for joining us tonight.
Thank you. Straight ahead
Thank
on
you
the
so much.
You're